So welcome again. I just want to introduce our speaker today, who is Beth. Beth is a clinical exercise specialist and cancer rehab instructor. While studying for her degree in sport and exercise psychology at Loughborough University, she became fascinated by the ways exercise could benefit people with cancer and long-term health conditions, because exercise can delay progression and help manage your symptoms and treat side effects of symptoms. So she says that she felt that there was a lack of provision in this area, and so she started her company, which is called Bounce Back Exercise, to create education, opportunity and support for people with cancer and other long-term illnesses. So I think this is going to be very interesting. I know that when I had my diagnosis, I would definitely have come to this meeting because I was struggling to know what to do. I've got a lot of personal stories there, but I remember. So I think it'd be lovely to hear what Beth has to say. If you have any questions, put them in the chat and I'll ask them to Beth answer, so she can do her talk, and then I'll ask the questions at the end of the talk. So that's everything from me. I'm looking forward to hearing from Beth. Over to you, Beth.
Okay, great. Thank you, Shara. So I will share my screen now. So before I start talking, I will just check you are all able to see this. Okay, just give me a thumbs up if you can see that. All right, great. Okay, so today I'm talking to you about exercise after a cancer diagnosis. So a little bit about me before we go on. So I've got a degree in psychology, did my master's in sport and exercise psychology at Loughborough University, which is where we looked at the benefits of exercise for all different kinds of clinical populations, one of which was cancer. And we looked at how exercise could benefit people through delaying the risk of disease progression and in helping people manage their disease symptoms and side effects. Then after university, I went on to become a personal trainer. I then did my level 4 qualification in cancer and exercise rehabilitation. And then I started work at a clinic in London, working with cancer patients, providing exercise. And then in 2020, I decided to set up on my own Bounce Back Exercise to increase that provision for people with cancer, make sure people in all different areas had access to that kind of support, and provide information as well online to help people. And then since then, I've also gone on to do my level 4 in exercise for neurological conditions. So I also work with people with Parkinson's, MS and stroke rehab. And then I'm also a freelance instructor for a charity called Move, which is a young person's charity. We work with 13 to 30-year-olds who've been diagnosed with cancer. I'm an ambassador for something called 5K Your Way, which is an initiative where we meet on the last Saturday of every month to do a local park run. And it's not necessarily to run, it's to be there to support one another, cheer, volunteer, anything people like. And then I'm a freelance instructor as well for Maggie's charity in Oxford. So I do 2 classes a week for them. So that's a little bit about me. So today in this workshop, I'm going to be talking about the benefits of exercise. Talking to you about the benefits of exercise, I'll be going through some cautions and things to be aware of with exercise if you've been diagnosed with cancer or if you're undergoing cancer treatment. I'll be discussing exercise pre-treatment, during treatment and after treatment. And then I'll be going through specific exercise to help with specific symptoms such as fatigue, muscle weakness, lymphedema. And then I'll talk to you a little bit more about what I do, what Bounce Back Exercise is, and how I provide support. Okay, so just going on to exercise in terms of managing symptoms. So exercise is hugely beneficial in helping address symptoms. So it can help improve muscular strength and bone mineral density, which is very often impacted by cancer treatment, such as chemotherapy, hormone therapy, surgery as well. It can help prepare for treatment. So it can put you in a much better position to cope with the treatment you're going to be having. It can help you manage treatment-related side effects, including fatigue, lymphedema, osteoporosis, and muscle wasting. So there's been a lot of research into this, and there is strong evidence to suggest that exercise can reduce all of those symptoms. It can help improve mobility and flexibility. Again, this can be impacted by treatment, particularly surgery. So it can reduce, particular surgeries can reduce your range of movement in certain areas. It can help improve balance, again, commonly impacted by chemotherapy, and also our balance just tends to get worse as we get older as well. It can help improve bowel and bladder function. It can help you maintain a healthy weight. So being a healthy weight as well can improve your tolerance to treatments. It can help put you in a better position for surgery or or whatever treatment you're about to go through. It can reduce the impact of pain. It can reduce the chance of acquiring comorbidities, including heart problems. It can reduce anxiety and stress. So exercise has been found to boost those hormones, those positive hormones such as dopamine and serotonin. So that can have a positive effect on your mood. It can improve your recovery rate from cancer treatment. It can reduce your time in hospital and can improve sleep. So hugely beneficial in helping you manage your treatment-related side effects and symptoms. And exercise has also been found to be incredibly beneficial in helping delay the risk of disease progression, and in some cases, prevent the risk of cancer recurrence. So I'm just going to talk a little bit about the research behind this. So exercise can help boost the immune system, helping it better recognize and destroy cancer cells. So regular exercise can increase the activity of immune cells, which play a key role in detecting and eliminating cancerous cells. It can also play a part in inflammation reduction. So chronic inflammation can actually promote cancer progression, and exercise can reduce inflammation throughout the body, creating a less hospitable environment for cancer cells to thrive. Again, so delaying that risk of cancer recurrence or cancer progression. It can also do this by helping regulate hormones. So exercise can regulate hormone levels such as insulin and estrogen, which have been linked to the development and progression of some cancers. So by managing healthy hormone levels, exercise can reduce the risk of cancer progression. And lastly, it can have an indirect effect through stress reduction. So regular exercise can help reduce stress levels. Chronic stress has been linked to an increased risk of cancer progression. So by reducing that stress, exercise may indirectly lower the risk of cancer progression. So this is all pretty powerful stuff, really, but really important to know and be aware that exercise, a lot of research has gone into this, and exercise can potentially delay or prevent that risk of cancer progression and recurrence. So just going on to a few cautions and things to be aware of with exercise. So some of these may apply to you, some not. These are most important to consider while you are currently in treatment. So if you have been diagnosed with, or if you have neutropenia, so that low white blood cell count, then avoid high intensity exercise, avoid settings with an increased risk of infection, such as public pools, and make sure to sterilize equipment and washing your hands as well. If you have asymptomatic anemia, you can still exercise, but this is the time to avoid high intensity exercise. So that's that HIIT training where you're working hard, working to a high intensity and then need to rest. So avoid that, as well as heavy weightlifting. So you can still weightlift and still lift your light weights, but avoid anything heavy, anything strenuous, and make sure you monitor for symptoms as well. And so those two are important to consider while you're undergoing treatment, particularly chemotherapy. With hypertension, if you've been diagnosed with high blood pressure, then just be cautious again of high intensity exercise or heavy strength training. With weak bones caused by bone metastases, myeloma, or osteopenia, avoid high impact activity. So that's any kind of running, jumping, contact sports as well. And also exercise promoting spinal movement that may increase your risk of fractures. So just be careful with any kind of rotational movement and bending movement. So maybe something to consider if you're gardening as well. Make sure you're bending from the knees, from the hips, something you can still do, but you are just then at an increased risk of bone fractures. So that's something to consider after treatment as well. And then with peripheral neuropathy, that can occur as a result of chemotherapy treatment, just be cautious with activities on uneven surfaces and any advanced balance activities and training requiring hand grip or ankle stability. You may also be more sensitive to certain surfaces, so just bear that in mind. But you are more at risk of falls if you have got peripheral neuropathy. So that's why you do want to be careful with that balance, with balance activities. But it still means balance exercise is really important to practice. So exercise pre-treatment, I've got the golden window of opportunity up there in that right-hand corner, because this is the most important time really to put yourself in as best position as possible to prepare yourself for treatment and to cope with any potential treatment-related side effects. So exercise before treatment is hugely beneficial. For some people, treatment's immediate, so you don't have as long or any time at all. For others, you might know about your treatment coming up in a month's time or a couple of months' time. So you really want to capitalize on that time beforehand. And because exercise has been found to improve your tolerance to treatment, it can result in fewer or less severe side effects. It will give you more treatment choices. So if you are fit and healthy, as strong as you can be, you've got more option for treatment. It can reduce your length of time in hospital, and it can result in better recovery as well. So here are some suggestions. So before treatment, you want to be working towards participating in 150 minutes of moderate to vigorous aerobic physical activity per week. So that's your cardiovascular exercise, that's your walking, your cycling, your swimming, anything you like. And it can be broken down into the week. So you don't need to do 150 minutes over 3 days. You want to spread it out quite equally over the week. You want to be taking part in 2 strength training sessions per week. So I'm going to be going on to these in a little bit more detail later on, but these 2 forms of exercise are so important, and you want to really make sure you're incorporating these into your weekly routine. And you want to take part in exercises to address any specific weaknesses, disease-related symptoms, or potential treatment-related side effects. So this depends on your diagnosis and is most important in the case of preparing for surgery, for example, breast cancer surgery or prostate surgery as well. You want to consider the impact that surgery might have. So that might be your pelvic floor exercises, practicing as much as you can before prostate surgery, or practicing that range of movement in your chest and your shoulder if you're about to undergo breast cancer surgery. Okay, just moving on to exercise during treatment. This is the time it's really important to listen to your body, because the amount of physical activity each person can handle will vary depending on the type of treatment, the type of cancer, the treatments received, the side effects experienced, and your levels of fitness beforehand. So if you have a good background of exercise, of being physically fit and active, you might find you're able to cope with a little bit more during treatment. If you have never done much before, you might need to take it a little bit slower. But some tips if you're exercising during treatment: start small and build up slowly. So this isn't the time to start anything new or move into anything too quickly. Just see how you cope with exercise alongside your treatment. Make sure you consider your treatment-related side effects. So with a PICC line, it's important to avoid lifting weights, or at least lifting heavy weights. So you'd still be able to lift your weights, but keep them by your sides, or just do some unilateral work. So you're working one side of the body and then the other without the weight in your hand, because you want to avoid any risk of irritation of that PICC line. If your immune system is compromised, just be aware of that. That's when you want to avoid those public spaces. And also make sure to wash your hands, sterilize equipment you're using. Listen to your body. If your energy levels are low, don't be afraid to adjust how long or how hard you exercise until you feel well enough again. So there's no harm in just starting a workout, or starting a walk, starting a class, and getting halfway through, finding out you're not feeling great, and then stopping. Really listen to your body and take that time, because if you're not feeling great, if your exercise is making you feel any worse, that is when you do want to stop. Stay hydrated and eat a nutritious diet. So drinking lots of water, particularly while you're exercising, is really important. Make sure to eat a healthy diet, because this can play a big part as well in helping you cope with that treatment. And particularly while you're exercising as well, you're more likely to become dehydrated, and getting in sufficient levels of carbohydrates and protein as well is even more so important. Check in with your doctor regularly. So just make sure your blood count is okay if you're exercising during treatment, and particularly if it's chemotherapy. If it's fine, you'll be all right to continue with your exercise, but just good to bear that in mind as well. So it's not, bear in mind with your treatment, it's never, you don't want to be expecting a gradual increase or progression with your exercise. It is going to be up and down a lot, and that is fine. So just consider that as well. Then exercise after treatment. So
Hello, I'm Dr. Shara Cohen, and I founded Cancer Care Parcel to fill the gaps within the cancer community. Our mission is to provide comfort, support, and resources to all those affected by cancer. At Cancer Care Parcel, we write informative articles, we donate thoughtful care packages, and offer free webinars to educate and support, but we can't do it without help. We need support to continue our efforts. Please help us spread the word about our mission. People can support us by purchasing an uplifting mug, perhaps an awareness t-shirt, something from our store. Every purchase helps fund our activities. Ask your friends to buy something for you or for them. Please let people know about us and who we are. You could consider donating to our GoFundMe campaign. Your donations enable us to give away more care packages to those who need them. And as I said, every little bit helps. Though we are a company, we operate as a non-profit, often running at a loss because our priority is helping the cancer community. With your support and your friends, we can continue making a difference. Please visit our website or our GoFundMe campaign to learn how you can contribute. And thank you so much for your kindness and support. Together, we can make a positive impact. Thank you very much.
If you're coming to the end of treatment, or even if you're coming to the end of the worst part of your treatment, this is when you might want to start thinking about progressing your exercise, building back to a more normal routine. So some tips for this. Start slowly and build the intensity and duration up gradually. So it might be that to begin with, you schedule just 5 minutes every day or 5 minutes every 2 days, but really important not to rush into anything too quickly. Resistance exercise. So again, I can't stress it enough how important resistance exercise or strength training is, and you want to be doing this 2 to 3 days a week. And for anyone who doesn't know what resistance exercise is, it's strength training, and that involves any kind of exercise where you're moving your body against a force. So it could be that you're exercising just using your body weight, like doing a sit to stand, a squat movement, a calf raise movement. It can be that you're using weights. So I encourage people, if they're new to exercise, just to start off with things like cans of beans or water bottles, just to use as very light weights. Then maybe progressing to dumbbells, and you can get these anywhere really, on Amazon, in local shops. And exercise with resistance bands, another great source of a thing to use for strength training, or going to the gym and using some equipment there as well. So there's a lot of options for resistance exercise, but so important. Then cardiovascular exercise. You want to be building back your cardiovascular exercise, working back into that 150 minutes per week. So that can be broken down into about 20 to 30 minutes daily. And cardiovascular exercise involves any kind of aerobic exercise, anything that's aiming to get your heart rate up, your blood pumping. So you should feel a little bit more breathless doing this form of exercise. And that can be walking, running, if that's something you want to work back to. It can be swimming, cycling, so on a stationary bike, or just going out for a bike ride, or participating in a cardiovascular exercise class as well. So there's lots of ways that you can get this in. Dance as well, that's another form. you want to be focusing on flexibility to improve your range of motion or movement. So your flexibility and mobility can be impacted by all kinds of treatment. So you want to take part in range of movement exercises and stretches, and these can be incorporated into your workout, into your full workout, so into your cardiovascular one or into your strength session. And that would involve starting off with some mobility exercises, so dynamic stretches such as leg swings, arm circles. And then you want to be finishing with static stretches, such as this one on the picture. So this lady at the moment, or man, is holding a hamstring stretch there, but you want to finish your exercise with some static stretches. And then balance training. So all older adults should be practicing balance training, and particularly those who have gone through treatment that might have affected your balance. And you should be practicing around these balance exercises 2 to 3 days each week. And remember to rest. So rest is really, really important as well, alongside your exercise routine. With strength training, also with that resistance exercise I mentioned, what you're essentially doing is damaging the muscle fibers. So rest is just as important in the part of the process, because you need that rest period the next day to allow your muscles to recover, build back stronger, and repair themselves. So make sure to get enough sleep, and just give your body some time to rest. You don't need to be exercising all day, every day. Okay, so I'm just going to talk a little bit about exercises to address specific symptoms next. So I'm going to go through fatigue, exercise to help with muscle weakness and loss of bone density, exercise for balance, exercise for weakness on one side, and exercise for managing lymphedema. So exercise for fatigue. If you suffer with fatigue, which maybe as a result of your treatment, then exercise snack. So what I mean by this is breaking your exercise down into smaller, much more manageable chunks. So this might be 5 minutes of exercise each day, 10 minutes, 20 minutes. But again, start slowly. If it's quite severe fatigue, then start with a very, very small amount. And then each week, just try to increase this very gradually. And below, this is a picture. So I run a membership, an online membership, which I'm going to talk about at the end. But this year we introduced a range of shorter length classes. So these 5 to 20 minutes are great for days that you're lower on energy, feeling more fatigued. Stay hydrated. So drinking lots of water and staying hydrated can help avoid dehydration, and dehydration is a big factor that can contribute to fatigue. So we want to be aiming for 2 liters of water per day. Stay consistent. So we really want to avoid the boom bust cycle, where you end up doing loads and loads when you're feeling really good, and then nothing at all when you're feeling really low, really tired. We want to avoid that. So that is why we start small, doing something manageable every day and stick with it. So a little bit every day and then building on from there. Warm up and cool down. So by warming up, that can help prepare your body for the exercise that you're going to be doing, such as your strength workout, going for a walk. So just take some time to just start slowly with smaller body movements, such as shoulder rolls, ankle circles, just building into it gradually, and that will help bring the heart rate up gradually, reducing those levels of fatigue. And then also remember to cool down. So cool down at the end of the workout by gradually returning your heart rate to its resting level and going through some stretches. Just doing this, even if it's just 5 minutes at the start, 5 minutes at the end, it can help with fatigue levels as well, help reduce the risk of feeling more tired at the end of the workout. And you can modify your workout. So again, I mentioned this earlier on. If you start a session, so if you go out for a walk, you start with 5 minutes and you're not feeling great, then that's absolutely fine. Just come back home again. Or if you start an exercise class, you get through 10 minutes of it and you feel like that's enough. If you're feeling fatigued, then don't worry, that is fine. And then lastly, think about timing and routine. So some people suffer with fatigue in the morning, some people it might be later in the day, some people it might be in the middle of the day. But bear that in mind. So you can maybe create a fatigue diary where you write down your energy levels at different periods throughout the day. And where your energy levels are highest, that is when you want to be doing your exercise, not when you're feeling your lowest. Okay, so I'm going to go on to exercise for loss of muscle mass now and to improve bone density. So this is where your strength training is important, and I'm going to be discussing two types of strength training, two types of resistance exercise. So we've got our functional strength training, and you can see some examples of these from this picture. These are any movements, going through any movements using resistance, such as body weight or weights. So in this picture, they're using, I think it looks like big water bottles there, to go through exercises that resemble movements we do in day-to-day life. So this is a push movement, pushing forwards, a pull movement, resembling any kind of pull of the door or pull of anything at all, a squat movement, which resembles sitting down and standing up from a chair, a lunge movement, which resembles climbing stairs, a hinge movement, which resembles the movement of picking something up from the floor, a rotational movement, and gait as well. So these are our functional strength exercises that we want to be incorporating. And then we've also got isolated strength training as well. So I'm just going to talk a little bit more about these. So with these types of strength training, you can also do them together. So you can do your strength exercises incorporating a little bit of functional work and isolated work, or you can split it up, doing one as all your functional movements, one as your isolated movements. So functional strength training. The benefits of this are that it improves your ability to carry out everyday tasks, such as sitting down, standing up off a chair, pushing a shopping trolley, pulling a heavy door open. It works multiple muscle groups at the same time, so you've got big muscle groups involved. It has proprioceptive effects, which helps with balance and body awareness. This can improve motor control and coordination in more complex tasks. It can engage the core muscles as well. So if you're doing a movement such as a sit to stand or a squat movement, your core muscles in your stomach and your back are also working. So it's not an isolated movement, and this can help improve posture. However, with functional strength exercises, there are some things that you want to consider. So you are at an increased risk of injury due to lack of technique, particularly in people who do not have the correct range of movement. So if you are brand new to exercise, you might want to avoid some of these bigger exercises or bigger movements just to begin with. They also put more stress on the joints because they are, again, bigger movements. And they can result in slower muscle gain than traditional training because they fatigue the body centrally rather than peripherally. So that means you're tiring, you're going to have to stop because the whole body tires rather than a specific muscle group. So really important to incorporate into your training. But if you are new, you might want to leave it a few weeks to make sure you build back your range of movement before you go into this functional strength work. And then traditional strength training. So this is where you are isolating a single muscle. So an example of this would be a bicep curl. So you're not tiring the whole body out, you're just tiring a specific muscle out, that bicep here. Or a lateral raise, when you're lifting the arm out to the side, it's not tiring the whole body, it's just fatiguing this muscle. So some benefits of this type of training. So simple isolated exercises can be more effective in muscle growth and hypertrophy. So that means an increase in muscle size. And this is because you produce better motor output to the targeted muscles and you aren't limited by coordination or overall fatigue. So you don't need to stop because you feel overall tired. The movement's able to continue until that muscle specifically tires. So this results in increased strength and is more positive in contributing to that increase in bone mineral density as well. So by focusing on one muscle group at a time, we can get that muscle close to failure, which again is an important factor when it comes to muscle growth. And this is the thing we want to be working on because it has been impacted by our treatment, such as hormone therapy, chemotherapy, because we're feeling weak. And it's also as we get older again as well, or as we become more inactive, we're again more likely to lose that muscle. So this is what we want to be practicing. These kind of exercises are all much lower impact and friendly on the joints. And this means there's less chance of injury, as you don't need to worry about stabilizing the joints because it's just a simple one movement at a time. However, there is limited usefulness with this and applicableness to day-to-day life. So these movements don't necessarily resemble the movements we do in day-to-day life. So while it's really important, we want to be combining this kind of exercise with our functional strength training as well to make sure we're able to do the things we want to do in day-to-day life, such as pushing, pulling, climbing stairs. So our two types of strength training, you can do them together in one workout, or you can separate them into two different ones. But yeah, think about those different movements. Okay, and then exercise for balance. So older adults and people who've gone through cancer treatment, which may affect balance, should practice balance exercises 2 to 3 days a week to reduce the risk of balance impairments and falls. And we should be practicing 4 different types of balance exercises. And this is because we don't want to be doing the same balance exercise over and over again. If all you're doing is practicing standing on one leg, first of all, you're going to be working the same muscle groups. You're not varying it. Whereas if we vary it, we're going to be targeting different muscles. A second reason for this is, it doesn't apply to day-to-day life as much. So you might feel very confident just standing on one leg, but there might be another balance exercise that you haven't tried that you're rubbish at. So we want to vary it to make sure it resembles real life a little bit better. It's also important for helping ensure that we don't reach a plateau. So if we practice the same balance exercise over and over again, we eventually are likely to reach a plateau. We're not going to improve our balance any more than that. So lots of reasons we should be varying our balance. And these are by static versus dynamic stability postures. So a static stability posture is one where you're just standing still. So an example would be just standing on one leg. I'm going to get up and demonstrate these so you can see me actually, and you're welcome to join in if you want to. So we've got a static stability posture, which would be standing on one leg, and then we would just make it dynamic by bringing in an arm swing. If this feels really difficult, you can do it instead with one foot in front of the other, standing as still as you can, and then making it harder by adding in an arm swing. So that is one way we want to be challenging our balance. A second way is changing the base of support. So we might practice a movement with a wide base of support, just going through a few squats. This should feel relatively easy unless your balance is very, very poor, and this is the first exercise you've done since your treatment. Should be quite manageable. We make it harder by coming into a narrow stance, just a very small bend of the knee, and then make it even harder by standing on one leg and going for a single leg one. Then we want to vary the height and center of gravity. So when we're doing these balance exercises, we want to change it. So we might do it with our feet together, keeping the center of gravity around the height of our stomach. Or we change it by just bringing one foot in front like this, bring the arms in front. So again, we are changing the height and center of gravity while we are practicing our balance. And then lastly, this one is really important for that real world applicableness. We want to change the standing surfaces. So you might find it perfectly fine to stand on one leg on a flat, hard surface. But if you tried it on a cushion or on a rolled up towel, it might be much more challenging. And this is important because in day-to-day life, we're walking around on many, many different surfaces. So we want to ensure that we're comfortable with those different surfaces if we're feeling a little bit unbalanced. So by varying these balance exercises, we're going to be much more prepared to deal with a situation where we're feeling unbalanced in day-to-day life, and this can reduce the risk of falls. Okay, exercise for lymphedema. If you have got lymphedema as a result of your treatment or surgery, then just make sure when you're exercising, you're wearing your compression bandages or garments. And these compression garments can increase the efficiency of the muscle pumps in moving the fluid away from your limbs, trunk, or face. So without the compression, the increased circulation and increased production of lymph fluid would collect in the areas that are swollen. So just make sure you're wearing these. If you're swimming, this is the one time you don't need to worry about wearing them, because you've got less weight on you because you're in the water. If you're beginning exercise as well, make sure you start slowly with no weight, doing active range of motion exercises, and just build up gradually. So if you're new and you're going to start your strength training after today, then brilliant. But maybe just start off, if you do have lymphedema, with some very light weights, such as cans, water bottles, and then progress to your dumbbells. You can progress to a lightweight strength session. Just make sure you don't do strength sessions back to back to allow your muscles time to recover and repair. So I mentioned this earlier, this is the same for everyone, whether you've got lymphedema or not. When you do strength training, you don't want to be doing the exact same thing the next day, because you do want to allow your muscles time to recover. And your exercises should be pain-free as well. So if you are experiencing any pain, then stop that movement. Okay, just going on to staying motivated, because I think this is something that a lot of us can struggle with. So if you are not feeling motivated, then just start small. Just begin with something very little. So something like 5 minutes, 10 minutes, that is fine. And I find so often, if I'm not feeling motivated, once I've started, I do actually end up doing more than I planned. So just by putting on my gym clothes or whatever I'm going to wear for my exercise, or starting with just 5 minutes, I do find I'm enjoying it. I stick with it for longer. Create a routine. So routine and consistency is so important in every sense, really. So ensuring that you get the right exercise in, and also ensuring you stay motivated as well. So for this, I recommend using a diary or a calendar and just scheduling in the exercise that you're going to do, or just you can write exercise, maybe even put a little tick box, and then once you've done it, you can tick it off. But with that routine, you will eventually, it will take time. It can take a month, 2 months, but if you stick with it, even if you just do 5 minutes of it, you will find that if you don't do it, you're going to start to miss it. Remember your why. So I've gone through the benefits of exercise and how important it is. And I'm sure there's something on there that motivates you. And maybe it's something that I haven't said, but what you could do is write this down, remember why you're doing it, put it somewhere that you're going to see it, such as the fridge. And then maybe if you're feeling low on motivation, just go and look at your post-it note with your reason why you're exercising, as a reminder that you need to do it. And mix it up. So if you're going through a period where you're not feeling motivated, not feeling inspired to exercise, then why not try something a little bit different? So if you're doing the same thing or you've not done anything, then maybe try something new. Or if you are doing the same thing every day at the moment and you're feeling bored of it, you're not feeling motivated, then why not try and join a new dance class or a Pilates class, or go onto YouTube, type in exercise for so-and-so. Something will come up, and I think there is something out there for everyone. And then lastly, exercise with someone. So if you're not feeling motivated, accountability can make a huge difference. So I know some people, what they do is they will, if they're doing their exercise online, they will maybe encourage a family member to do it with them. So that family member will ask them at the time that they had it scheduled in, will you do it with me? Or even a friend to come around at that point. So that can help with motivation. Or you can join an exercise class. There are loads and loads of in-person exercise classes. If you can go onto the Macmillan website, or another site is called the Cancer Care Map, and you type in your location, and there will come up with the nearest class to you, whether it's a cancer rehab class or just a general exercise class. And then there's lots of classes that you can do online. So my classes are all via Zoom. And I have a members library as well. Some people are great with the members library and they'll get on with their exercise on their own. But a lot of my members will only come to the live classes because they've got me or the rest of the group at the other end, motivating them to attend or to do their exercise. So there are a few tips on staying motivated. Okay, and then this is what I do. So bounce back exercise, and that is the website, www.bouncebackexercise.com. So I have got a free exercise guidebook on my website that you are very welcome to go and download. So in this guidebook, it goes through similar things that I've spoken about today. So I talk about the benefits of exercise. It goes through exercise recommendations, exercise for specific symptoms, where you can find further support, how to stay motivated. And it's also got some top tips from people with cancer. So I've asked quite a lot of my members or participants in my classes to write me what helps them. So you can find some of them on there as well. I do group exercise classes. I do them both in person and online. So I'm going to talk about my online membership too. And then I provide one-to-one support, and this is both online and in person. So this is a picture of my online program. And I started this at the end of 2020. And the reason I wanted to create this online program was because there's a lot of information that I've gone through here, as I'm sure you've all noticed. And it can be a little bit confusing. People are wondering, how on earth can I put this into my week? How can I make sure I'm doing everything I need to be doing? So I created a program which includes 5. It started off 4. It's now I've introduced the shorter length classes as well. So now it's 5 weekly online classes, which include everything that you need to be doing to benefit from your exercise. So it's got your cardiovascular exercise in it. It's got your resistance, your strength training. It's got balance work, mobility work, core work. And I've also got a library of classes to help people cope with specific symptoms and side effects. And I mentioned how important consistency is. So the idea of this program is to help people ensure they maintain that consistency because they've got that structure in their week. So this is the class timetable. It stays the same most weeks. Monday's class is functional fitness. So this goes through those functional exercises I mentioned earlier. So challenging your strength, but making sure it's in a functional context. Tuesday's class is mobility and stability. So in this class, we go through common areas of tightness and weakness. We also go through our balance exercises in this class too. So for our common areas of tightness and weakness, this is the shoulders, the hip joints, the knee joints, the ankle joints. They all are joints that can be impacted by surgery and by treatment as well. On Thursdays, I do a core control and stretch class, which involves targeting the abdominal muscles and the back muscles. It involves mobility and flexibility work. This is the one class which requires people to get up and down off the floor. So if people don't like to get up and down off the floor or aren't ready for that, I've then got our bounce back mini class, which is a little bit later on in the day. And this is our shorter length one. It ranges from 15 to 20 minutes. And I vary it each week. Sometimes we do seated core. So you're still getting your core exercises in if you don't want to get up and down off the floor. And then on Friday, we go through our strong and balanced class. And this involves those isolated exercises that I mentioned to promote muscle growth and increase bone density. We go through some balance exercises in this as well. And we also go through a lot of unilateral work. And unilateral style training involves training one side of the body at a time, so your right side and your left side. And this is really important and really beneficial if you've got any muscle imbalances, which again could be because of surgery, could be because of treatment. If you've got a weak side and a strong side, this can help eliminate those differences. And it's also good for improving your balance, because by doing one side of the body, then the other side, you're utilizing your core, again, stomach and back, to help you stay balanced. So this is our Friday class. And then on the days between, I do encourage people to get in there a little bit extra cardiovascular exercise by going for a walk, or this can be substituted with a swim or a cycle, anything that people like. So those classes are all the live ones. They're delivered via Zoom at a fixed time. Then this is our members library, and I've got in this exercise classes to target specific symptoms. So this includes balance classes, exercise classes for specific areas that are limited by mobility, exercise classes if you've got a weakness on one side, ones for joint instability, and shorter length ones as well to help with fatigue. Then uploaded into the members library, it also includes all our most recent classes. We've got our range of shorter length classes, and we've got a series of resources as well. So that includes workshops, educational tools to help with your strength, fitness and balance. So if you are interested in getting in touch, then you're very welcome to. My email address is on there, and that is the website where you can find all the information about this, what I do, and also that guide, that cancer exercise guidebook as well, that is under my free resource section. So I will finish there. I will stop sharing the presentation, and then just let me know if anyone's got any questions.
We've had a few questions already. Does anybody want to put in some questions whilst I'm looking through them? If you've got any questions and you want to type them in the chat, we've got a few minutes. So there's one question, I've never exercised before. What should I do to start?
Okay.
Yeah, have you got any?
So if you're new to exercising, that is when you want to begin slowly or just start off with something manageable. So if walking is something you like, I recommend just starting off very slowly, maybe trying to do 5 minutes of walking every day to build up your initial level of fitness. Once you feel happy that you've got a baseline level of fitness, then I'd recommend starting to incorporate so maybe spend a couple of weeks on that, and then start to incorporate the necessary exercise you need to be doing. So you want to schedule in your 2 strength sessions, and your 150 minutes of cardiovascular exercise by gradually building up that walking throughout the week. And with your strength work, if you're not sure what to be doing to begin with, then I definitely recommend joining a class or going onto YouTube, putting into YouTube strength session that you're looking for. There's a lot out there. I've got a free, well, YouTube is free, a channel called Bounce Back Exercise, where you can find there aren't loads of videos on there, but there are some videos that are taken from my classes, so you could have a go with them. But yeah, make sure you're guided to begin with, so you understand what you're doing, what you should be doing.
Okay, and then there's another same person, Sally, says, I had a hysterectomy, so I think I will lose bone mass in the future due to early menopause. Is there something I can do for that? It's a bit out of your...
Well, yes. Well, strength training, that is the form of exercise that is going to benefit your, and that is going to improve your bone mineral density, so increase bone mass. So that is why strength training is so important, as well as helping you manage fatigue and helping increase strength, reduce muscle wasting. It also has a really positive effect on bone mineral density, which contributes to bone mass. So make sure you are doing that.
And Beverly asks, what are the best exercises for hand and arm lymphedema? I know quite a few people with lymphedema, actually. I think this is a very important question. Do you have any suggestions?
So for hand and arm lymphedema, you want to be just practicing range of movements, so things like wrist circles, shoulder rolls, anything light, and then gradually building on from there, because exercise can be beneficial in reducing lymphedema. Just begin slowly with it, so range of movement, circles even with your elbow as well, and then gradually increasing what you're using, so doing the same thing but holding like a hand weight, and then moving on to your arm strength exercises.
I'm on letrozole and having awful arthralgia in my knees. What can I do?
So with any kind of joint pain, if you're experiencing very severe pain, you want to limit it to non-weight bearing exercises. And so an example of this would be a seated leg extension. So if you're just sitting, show you, on your chair. Move back so you can see. You can do it with me. So if you can see, all I'm doing is just extending the leg and controlling it down. So there's no pressure, there's no weight isn't over the top of the joint, but what you are doing here is strengthening the muscles around that joint. There are lots of exercises like this, but you want to be targeting the muscles around the joint that is weak or the joint that is painful, but without putting weight on it, so without it being a full squat. And then with time, as the muscles get stronger around it, the joint's going to be more supported, and that's when you would eventually progress to your body weight exercise. But again, I've got a lot of because that is such a common thing people experience, a lot of my classes I do, so particularly these shorter length ones, I've done ones for the people who are experiencing joint pain, starting off from the very basic level, and then progressing through.
So do you need to buy any equipment?
So yeah, if you're starting your exercise, if you're doing it at home, if you go to a class, most often they'll provide the equipment. But if you are doing it at home, I recommend purchasing just basic equipment, which is some dumbbells, and you can get these off Amazon, Argos, any shop really. They don't cost much at all, and I recommend getting between 1 and 3 kilos. I wouldn't, if you're getting any less, you can use something like water bottles instead. If you feel like you really want to progress your training, then maybe get up to 3 kilos. And while you're working with lighter weights, use the water bottles or cans for them. And then also resistance bands. Again, you can get them from Amazon. And you want both long ones, which are known as the TheraBand, and looped ones as well. These really do not cost much at all, but there's so much you can do to help challenge your muscles, use them for strength training. Other than that, the only thing we use in my classes are chairs, because we do a lot of sit to stand, so practicing that movement of standing up from a chair, and a wall, which we use for wall presses rather than a press up.
Are there any? Oh, I was about to ask. Do we have? There's one more question. I'm so tired though. How can I exercise?
Yeah, it is really hard when you're struggling with fatigue, and it does seem counterintuitive to exercise when you're suffering with fatigue. But exercise is really important and really beneficial. And this is because the fitter you are, so the bigger your lung and heart capacity, more able you are going to be able to cope with that fatigue. And also the stronger your muscles are, the less likely you're going to feel as fatigued day to day. So you really, really want to keep persevering with it, but begin very, very slowly, and just starting off with a little bit every day. So 5 minutes of walking every day, 5 minutes of strength training every day. And each week, maybe consider adding just a minute extra, nothing too much, but building on gradually. But it's so beneficial for fatigue. And as hard as it is to get started, I strongly recommend you do.
Okay. Are there any more questions? Perfect timing, actually. Are there any more questions from anybody? No, I think there's so much information, Beth, that you've given us. That's great. I saw people taking notes, people doing exercises. I think it was a valuable talk. We did, and people are saying thank you. It was, yeah, thank you very much. So I'm going to say thank you to Beth. I'm going to stop the recording. That doesn't mean I'm going away.